started way back in the 60s. I was in Little Rock, and my father was a Baptist minister, and I recall him coming to the hospital, the Baptist hospital, to visit sick parishioners, and I became familiar with the facility, and my family experienced the need for healthcare services through the years, and I have fond memories of the care provided, and we eventually moved off to Louisiana. When I completed my education, I had good memories of Little Rock and of Baptist Health, and so I approached Baptist about a possible job, and it all worked out. I know Mr. Gilbreth felt that it was necessary to be present, to be around the hospital, and so, you know, his work days were long, I hear. Our work days were long, and I think that example was established early on, and we knew that this was going to be a job that required long hours, and that you wanted to make sure that you visited with nurses early in the morning, you saw physicians later in the afternoon, you attended as many of the meetings of the medical staff as you could. You visited patients that that you were aware of, that were here, maybe from area churches, or employees who were patients. You know, you picked up a sense that was all very important, and you know, doing that required long hours, and we knew that he had put in long hours, and we just assumed that was required. And I think to a large extent, most of the leaders of the organization through the years have known that was what it was going to take to do this job well. To a large extent, Baptist Health has always been there for me. I mean, it's provided a place of employment for 30 years. I've had 2 children born at our Little Rock facility. I've had one parent who passed away here, and another who passed away under the care of our hospice organization. And it's a place, it's an organization that many people count on, and that we can't take for granted. That there's no assurances, there's no way you can sit back and just assume that Baptist Health will always be here and always be able to care for everyone, unless we take very good care of it, and we do our duties when we're placed in leadership positions to be mindful of the things that will keep Baptist Health healthy, just like our previous leaders did for 100 years so well. And so I think the one thing I would want folks to know is don't take this wonderful organization for granted.